Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. William Greenfield. He's a professor of obstetrics and gynecology at UAMS. Dr. Greenfield, thanks for being here.
Thank you very much for the invitation. I really appreciate it.
So we're talking about HPV. Tell us what that is.
HPV, human papillomavirus. This is a group of viruses, actually over 200 different related viruses that can actually be transmitted by skin-to-skin contact, particularly intimate skin-to-skin contact. And they are responsible for a number of cancers that people can develop, as well as other conditions such as genital warts. We think about HPV and causing different types of infections on different areas, but as an OBGYN, what I mostly see are areas of such as genital warts and precancerous and cancerous cervical conditions.
And can any age get it? Like, what is the age demographic that you typically see?
We begin to see it increase once people begin sexual activity in my line of work. So when we think about intimate sexual contact and once people become sexually active, then the likelihood of transmission begins to go up just simply due to exposure. Once we see that, people will frequently become infected by HPV, but in many cases, you may never have any symptoms. And then after you have that exposure in a population of people, some will actually begin to manifest different symptoms over a period of time.
Does it ever go away?
The body has the ability to suppress it with the immune system, and for all practical purposes, you could think about it as going away. However, if someone's immune system is suppressed or if they have other conditions, then they may in fact have some reactivation or some more evidence of the infection. As I said before, many people who have had exposure to it, they never have had any symptoms, but it doesn't mean that they have not had exposure to HPV. Typically, it's once the symptoms begin to show up or the features begin to be detected through things like a pap smear or cervical cancer screening, then we begin to do further investigation and further study. Now, some people can show true signs in terms of genital lesions, warts, vulvar changes. In fact, it can affect other different areas other than just the genital tract. We can have it in oropharyngeal, head and neck cancers. People can have it in other places than the ones we're typically thinking about.
So screenings are super important. What does that entail?
So when we do a screening test, the whole purpose of doing a screening test is to check for a disease or a condition when there are no symptoms present. So the goal, if you think about what a screening test is to find the problem early so that we know that it's easier to treat. HPV testing for cervical cancer is the only FDA-approved screening test where HPV testing can be used. So when we screen for cervical cancer, typically we can do cytology testing, or in some cases we can do HPV testing, or we can do both. And it is FDA-approved for cervical cancer screening. HPV can cause other types of cancers that I mentioned, but it's not on the FDA-approved screening test for those conditions.
Is that something a woman should have yearly? Like, what is the ideal time frame?
So if you think about cervical cancer screening, those recommendations have evolved over time. Once upon a time, the recommendation was to begin cervical cancer screening with pap smear or cytology at age 18 or within 3 years of the sexual debut. Several years ago, that actually changed, and now cervical cancer screening in women does not begin until the age of 21, even if you are sexually active. So typically no pap smears, no cytology before the age of 21. And there are different recommendations and different timelines for how often you screen. So the breakdown typically goes age 21 to 29, you will do pap smears and cytology. Age 30 to 65, there may be a combination of either HPV testing or pap cytology test, or a combination of HPV and cytology testing, typically from age 30 to 65. And then after 65, if certain conditions are met, then the recommendations are that those tests don't have to be performed again. But that part, when you get to that part, it usually requires a conversation with the healthcare provider to make sure that other conditions have been met, that there have been an adequate period of time of normal testing, and that a person's life situations don't raise the risk of them having new exposures.
And we're talking women, but men can get it too?
So HPV can be spread through intimate sexual contact. And so, yes, men and women can contract HPV. Historically, we've thought about this with cervical cancer, with this being a condition that affects women. However, HPV is associated with penile cancer. It can be associated with head and neck cancers. It can be associated with anal cancers. So it does not select only for women. Anyone who has had exposure to HPV is susceptible to having the changes and the consequences that come along with it. So yes, men and women can be affected.
And you've talked about prevention and how it can be transmitted. So what are treatments for it? Is it, once you get it, you've got it and you've got to treat it the rest of your life?
Well, the treatments are usually directed at the changes and the problems that result from the infection. So most people, in fact, who've had exposure to HPV may never have any symptoms at all. And so in those cases, then there wouldn't really be any treatment for the HPV. However, if someone has HPV and over a period of time they begin to manifest changes, then that's where you would direct the treatment. So in women's health, what we will see is when someone comes in for an annual exam or they come in for some type of cytology testing to screen for cervical cancer, what we may see is an abnormal pap smear. We may see abnormal cytology, or we may see abnormal HPV results. And then we see those persistently and consistently. Then we take it to another level. We move beyond the screening test. We move into a diagnostic realm of diagnostic testing, frequently in the form of colposcopy and a colposcopy-directed biopsy. And then based on those biopsy results and recommendations of best practices, that would direct us as to whether or not additional treatment is in fact indicated. If we identify a lesion or an area that is a precancerous lesion, and we typically grade those as a grade 1 if it is precancerous, it could be normal, it could be a CIN1, a grade 2 or 3. Based on those results, that would direct which way we need to do treatment. And if treatment is needed, for example, a precancerous lesion like a CIN2 or 3, then usually a LEEP procedure, a loop electrosurgical excision procedure, or a colon iconization would be indicated. If a cancer is identified, then additional treatment could be needed as well. Hopefully, if we've done proper screening, proper vaccinations, and a host of things before, we would never progress to that part.
So let's talk vaccinations for a minute. They are important. Tell us what the guidelines look like for that.
So the HPV vaccinations are incredibly important. Currently, we have HPV vaccine Gardasil 9, which protects against 9 different subtypes. And within that, 7 of these subtypes are the kinds that are most commonly associated with HPV-related cancers, and the 2 that are associated with genital cancers. We typically recommend that that HPV vaccinations begin. You can start as early as age 9, and this is for boys and girls. This most protection can be given if they receive it in that 9 to 12-year-old group. However, you can start at age 11 as well, and typically you can go up. There have been recommendations to go up to age 45. The idea is that by getting the vaccine, what you will do is to have the immunity developed before someone has exposure, because this is a vaccine that would help to prevent, not to treat HPV.
And you said up to age 45, so that means anyone younger than 45 can get it if they have not.
That's correct. So typically we will say up till age 26 as some of the recommendations, but there's been use in women and men who've gone from age 27 up to 45. Typically this is a conversation that should be had with the provider to see if in fact it's going to be most beneficial, because in fact if someone has not been vaccinated up until that point and they've been sexually active, it's highly probable that they may have had an exposure to HPV along the way. So the most important thing, if I were to say if there was a take-home message, is that the HPV vaccine will offer the most protection if you receive it prior to your sexual debut. So typically in the 9 to 12 or 11-year-old patient and up.
So that is my next question. A take home, a takeaway. What do you want gynecologists to know how to treat it?
So I think the most important thing to know is that HPV-related cancers can largely be prevented with effective vaccination. HPV vaccines are estimated to prevent about 90% of cancers caused by HPV infection, including genital warts. And when the cervical cells are infected by high-risk HPV, and there are other factors that may be present, then there's a risk of that HPV infection persisting and being long-lasting. There are certain things that we can do to prevent HPV from progressing if we have exposure. Things that would help, for example, would be not smoking, maintaining a good, healthy immune system, and being in overall good health. But the HPV vaccine is a cancer prevention vaccine. And that's something that we don't have in many, many situations. So to know that it can prevent up to 90% of cancers caused by HPV, that's the take-home message.
Well, Dr. Greenfield, thank you so much for sharing this important information. I appreciate you being here with us today.
Thank you very much.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.